Shocking coronavirus study says people could be locked down for 18 months. The Imperial College London report also says millions would die and that health systems would be overwhelmed. To mitigate the disaster, new measures would need to go into place immediately. The United States and United Kingdom received information from an Imperial College London coronavirus report that was published on March 16. Dozens of experts had informed policymakers that modeling showed millions would die and that health systems would be overwhelmed, the report said. A fight against a virus could go on for 18 months, it said. To mitigate the disaster, new measures would need to go into place immediately and last for months before being relaxed. Life would never be the same, the report said. This shocking study appears to have caused both US President Donald Trump and UK Prime Minister Boris Johnson to shift course and increase testing and measures. Optimistic projections about life returning to normal and the economy getting back on track appear to be unrealistic in light of this model. If airports are closed for a year and travel is limited for the same period, our lives will become increasingly similar to the 18th century in terms of what we do every day. The study and its aftermath raise important questions about known unknowns and unknown knowns. These tautologies were made famous by former US Secretary of Defense Donald Rumsfeld and are necessary in dealing with this virus. Why has South Korea had so few deaths? Why has the virus, according to China, appeared to stop spreading in the very place it began? Are estimates correct about it primarily affecting the elderly who have other illnesses? What happens if you have to quarantine a major portion of your medical staff when you most need them? Worst of all is the known unknown of testing. We know people have the virus, but we can't test them all quickly enough to stop the spread or identify the hot spots. What we are left with is a series of complex questions. Egypt reportedly has only 206 cases of the virus and 6 deaths. Could a large country like that, without much testing, simply miss large numbers of cases? Iran, which suppressed information about the virus's spread in February, claims it has 18,000 cases and 1,200 deaths. If countries lie about the number of deaths, or if they don't test at all, what do we know? We know enough to close borders, which is what countries are doing. Is that a death sentence for millions across the Middle East? It may be. However, since many of those who reportedly die suffer from other illnesses, there is reason to believe that in places like Yemen, the virus could spread openly, and most of the deaths will be misidentified. Ironically, the virus is, in some ways, more of a threat to advanced countries than those with weak or non-existent medical systems. This is because wealthier countries are more vulnerable to breakdown when life changes, and people demand a certain level of treatment. Poorer countries where millions are subjected to failed state structures have had to get by with existing health crises, such as malaria or famine. The question now for most countries is whether the models produced after the China and South Korea examples were correct. Changes in some inputs and assumptions can have dramatic outcomes. For instance, publics and democracies demand results, and the Imperial College study shows that results will take months to appear. Governments also do not react slowly like a flattening curve. Their tendency is quick fix solutions. However, the authors of the report noted that 4 interventions: social distancing, case isolation, household quarantine and school closures would have the largest impact short of a complete lockdown, which prevents people going to work. The elephant in the room at the end is the study never looked at the economic impact. It did note that after the initial suppression of the virus was enacted, interventions would be relaxed in September and infections would rise again. World leaders are not telling the public that this is what they face. They may be concerned that panic could result in civil strife and mass protest. The authorities have banned gatherings anyway, so there can't be protests. The end goal of the study and government policies is now to prevent the system from being overwhelmed. The question is which system will crack first, the medical, economic or governmental and security one. Those are the unknown knowns.